Welcome to the Hand Hygiene Training. Produced by Jan and Bev's Home Care for Personal Care Aid in Service Training. As a personal care aide, you care for people in many ways. Bathing, grooming, feeding, and attending to all sorts of needs. This care involves close contact and touching, often with clients who are ill, who have weak immune systems, or who simply can't afford to get sick. You must recognize that you are a common factor between all of your clients. This means that you can carry germs from one client to another, even if you don't feel sick. Many illnesses, such as the flu, can be transmitted before symptoms develop. This means that you must be on guard and use methods to prevent the spread of infection at all times. Once someone is sick, it's too late. You don't have to wear a hazmat suit all day long, but you should take simple yet effective measures every day. This in-service training will focus on hand hygiene, which is an essential component of preventing the spread of infection. Hand hygiene is the most effective way to prevent the spread of infection. Germs can stay on your hands and be transferred. Think of all the things and people that you touch in a day. You use the bathroom, go to public places, care for clients, touch your face, touch doorknobs and food. The list is endless. Practicing good hand hygiene helps protect your clients, yourself, your family, and others. You might think that you don't always have time to wash your hands, but in all the things you're rushing around to do, you might be causing more harm than good if you don't take a moment for hand hygiene. You should wash your hands before and after caring for a client, after caring for personal needs, such as using the bathroom, blowing your nose, covering a sneeze, and so on. Before eating, handling, or serving food or drinks. When you return from public places. Before and after each client visit. After any contamination or after handling waste materials, secretions, drainage, or blood. After handling soiled items, including linens, clothing, bedpans, urinals, or garbage. Before and after wearing disposable gloves. And before and after touching wounds. The CDC has guidelines for hand hygiene, specifically for hand washing. Follow the proper hand washing procedure as shown in this picture. You will find a copy of this hand washing procedure guideline in your in-service training folder. Please study the procedure guideline to ensure that you know each step of the hand washing procedure. Use warm water only. Hot water can damage your skin and lead to cracks, which put you at a higher risk for infection. Always wash your hands when they are visibly soiled. The entire hand washing process should take 15 to 20 seconds, or long enough for you to hum the Happy Birthday song twice. Alcohol hand rub products are more effective than hand washing with soap unless your hands are visibly soiled. Or you have a condition that is known to be spread by spores, or could potentially be spread by spores, such as norovirus or Clostridium difficile diarrhea. Please note that the effectiveness applies only to alcohol-based products. Avoid sanitizers in which the active ingredient is triclosan or others that do not contain 60% to 95% alcohol. Higher concentrations are less potent because they contain less water than lower concentrations. The reduction in water causes some of the original germ-killing properties to be lost or diminished. The CDC also has hand rub guidelines as shown in this picture. You will find these guidelines in your in-service training folder. It is important that you are familiar with these guidelines and practice them each time you use hand sanitizer to ensure the sanitizer is effective. This includes rubbing your hands for at least 20 seconds, or until your hands are dry. Your hands must be dry for the sanitizer to be effective. Thank you for completing this training. To finish the course, you must take the required test. You have two options. Scan the following QR code to access and complete the test online, or complete the paper test included in your in-service training folder. Please make sure your test is successfully submitted so your training can be recorded as complete. Thank you for your time and your commitment to maintaining safe, high-quality care.